So, why should physical therapists care about exercise selection after ACL reconstruction? Well, first and foremost, when you exercise, it's going to stress the knee, it's going to stress the ACL or the graft after you've had surgery. And in general, stress is neither good nor bad. So too much stress can obviously be problematic. We can stretch out the graft over the course of time, which is not something that you want. You can also cause failure, and that's not a good thing, right? The other piece is that we probably want a little bit of stress through the graft that may actually help with tissue healing over the course of time. So probably not a bad thing. It's just that we probably want to make sure that we're dosing appropriately so people can kind of optimally progress over the course of time. The other thing to think about with ACL reconstruction, and it's a little bit weird, it's different than other types of surgeries, is that when you have ACL reconstruction surgery, that ACL is actually pretty dang strong once you put it in. And what happens is that the graft undergoes changes over the course of time, right? So after you have the graft placed in, the graft goes through a period of necrosis. Okay, so part of the graft dies for the first 6 to 8 weeks. When you're around 6 to 8 weeks, and this is going to vary based on the study, all right? This study is from Mansky. You can check that out, link in the show notes. You will have a weaker graft at week 6 to 8 compared to when you put that graft in initially, okay? And then after that, you have a revascularization that occurs and ligamentization, which actually takes years to finish up, all right? So what's going to happen is that you have a graft that's a little bit stronger right after surgery and actually gets weakest around 6 to 8 weeks. Again, this really depends on the study you look at, but you have to think about this a bit because people start to feel better around 6 to 8 weeks. And if we're going, absolutely nuts with our exercise selection, we might be putting a little bit too much stress on the ACL reconstruction. Okay. So just keep that in mind. All right. And I'm going to make this argument today that exercise selection really matters. And there's a large variance in ACL stress amongst different exercises. So as physical therapists, it really helps if we have an understanding of what has, a lot of stress on the ACL versus a little stress on the ACL. Now, obviously, we probably want to start with low stress on the ACL. And as we progress through the rehab process, just start to increase, right? The last thing to keep in mind is that the ACL has to handle a lot of stress during sports. So we have to prepare the ACL to be able to do that, okay? So we need to know how to start low and build up high. Which exercise do I choose along the way to be smart in this process? So let's talk a little bit about quadriceps and hamstring co-contraction, okay? And this is a challenging concept to wrap your head around if you've never been taught this before, all right? I have some good images here that talk about and kind of display what I'm about to talk about. So if you're watching an audio version of this, I apologize. I'd say, head over to YouTube at some point to check this out. I'll try to describe this as best as I can, all right? But if you think about your quadriceps, so imagine you're sitting down, okay, and knee is bent to 90 degrees. Quadricep is the muscle on the top of your thigh. It is going to wrap around, attaches to your kneecap, which wraps around the knee and attaches to your tibia, okay? And when you fire your quadricep, think about a seated knee extension, right? You're firing your quad. That's going to extend the knee, right? That makes sense, okay? Quadricep fires, it shortens, tugs on the tibia, brings the leg up, okay? Extends the knee. The other thing that happens within the joint is that when you fire that quad, it's going to draw the tibia anteriorly. So it shears the tibiofemoral joint anteriorly, okay? Now, the ACL normally checks that or resists that motion, okay? And after you've had ACL reconstruction, when you fire that quad, and we'll talk about this quite a bit more later, you're going to cause an anterior shear, and that's going to put stress on the graft, okay? So that's one of the most important things to keep in mind here. Now, the hamstring muscle actually does the opposite, all right? So your hamstring attaches to the lower leg, just like the quadricep does, but it attaches on the backside of the lower leg, right? And when it fires, it imparts a posterior force to the tibiofemoral joint. So it pulls the tibia posteriorly, okay? It does the exact opposite of what the quadricep does, okay? So in some ways, the hamstring helps out the ACL because when it fires, okay, it acts as a dynamic stabilizer of the tibiofemoral joint and assists the ACL or reduces some of the stress on the ACL, okay? So when you fire the quad, it pulls the tibia anteriorly and increases stress on the ACL or ACL graft after surgery. And when you fire the hamstring, it reduces stress on the ACL by imparting a posterior translation of the tibia. All right. So, spoiler alert, but we can choose exercises that either have an active hamstring contraction component or no hamstring contraction component. So basically, we can choose exercises that are going to cause more anterior translation or less. Okay. And this is how we dose exercises, right? We'll talk about this more a bit later. The other thing we're going to chat about is going to be open chain versus closed chain exercises. So on the left, I have an image of myself squatting. This is a closed chain exercise. So basically, my feet are fixed to the floor, okay? And my torso is moving up and down. Hips are moving up and down, all right? An open chain knee extension. So imagine I'm doing seated knee extensions or a long arc quad. My body is fixed and my foot is swinging openly, all right? So a closed chain exercise, spoiler alert, is generally a bit safer than an open chain exercise. And we'll talk about why this is. So when you're doing an open chain knee extension exercise, right, seated knee extension, this is a bit of a no-brainer, you are isolating the quadriceps, meaning that the only muscle working is really your quadriceps, okay? The hamstrings are relatively quiet during this movement. And because of that, you're getting a lot of quad activity, and that's being unopposed by the hamstrings, and you're getting increased anterior translation, right, of the tibia. Okay. So an open chain knee extension, there's no assist from the hamstring, which normally is going to reduce stress on the ACL. So open chain knee extension is going to be a bit more stress on the ACL based on this principle. Okay. In the closed chain, so we're talking about a squat here. When I squat, my quadriceps are going to work, but my hamstrings are also going to work. And they call this a co-contraction. All right. What ends up happening is that you have the hamstring firing with the quad. And because of that, it's kind of like a tug of war at the tibiofemoral joint. And that's going to reduce the amount of translation that goes on in the joint. All right. And because of that, there's going to be less stress on the ACL graft. Right. Talk more about this later because this is nuanced and we can alter this based on our exercise selection. So if you are loving what you are learning right now, I highly recommend you check out my fitness pain-free episode where we go over a patellar and quadriceps tendinopathy guide. I will leave a link in the show notes. Definitely recommend checking it out. You can also click on the link right above if you're watching this on YouTube and get started watching right away.